Well, good morning, everybody. It is Friday. We are coming to you live back in Eugene, Oregon. I wanted to put out a little information about what has been obviously on everybody's mind about the coronavirus, the COVID-19. Would try to not get into the politics and focus more on what people are asking me in the office and clinic about. The obvious problem that we're having across the country, including here in Lane County, is the access to enough test kits. And for the time being, until that is further addressed, common sense tends to be the rule of the day, which if people have traveled to areas that are known to be coronavirus laden, that those folks are self-quarantining. My understanding is in this area, if people have the typical symptoms, Riverbend Hospital emergency room is the place to go to get tested. However, most coronavirus patients don't have that severe of a degree of symptomatology and may just present with symptoms like a common cold. What sets COVID-19 apart is the propensity of affecting older patients, especially those with immune compromise problems that may put them at higher risk. And also those are the folks that we're finding that are living in, for example, assisted living facilities or in confined centers where there's multiple people coming in and coming out in mass numbers. COVID-19 is a variant of a coronavirus, common cold virus that we've seen before, but not this mutation that, as mentioned, the majority of patients present with sometimes very mild symptoms that may mimic a common cold, with runny nose, a dry cough, typically more of a dry cough, and maybe mild shortness of breath a few days after onset of symptoms, but majority of symptoms, that's what most people have developed. The more serious cases, especially those I mentioned earlier that are immune compromised, approximately 7 to 8 days later, they may develop a more extreme onset of very significant shortness of breath that may lead them to seek emergency help in the hospital. Many of these folks may require admission because of difficulties with maintaining oxygen levels, and they may need to be taken care of in an ICU setting. But those would be the minority. We have to remember we are also technically still flu season, where influenza A, influenza B, H1N1 virus may be more likely to be causing flu symptoms, but nonetheless, with all that's going on around coronavirus, this is what's getting the media's attention, and for good reason. Right now, our policy is to keep people at home. If there's in doubt, they will be asked to not come to work. They'd be working, if possible, from home. Contact your physician's office with directions as to how to proceed. And I think if those symptoms of extreme shortness of breath and difficulty breathing develop, they need to go to the hospital to be evaluated. But the good news is that majority of folks it's self-resolving. It does resolve with time, but I think the importance now is maintaining as they've been pushing at the state and national level, a social distancing policy, which means if you think of going to big groups more than 25 people at a time, you might want to not go. Thankfully, the community organizations here and across the country, I think, are wising up to the fact that big campuses, colleges, school districts, social events like going to the local choir or concert halls, probably not a good idea right now. Most programs are being postponed for a good 4 weeks, possibly longer, to contain. Many of you may have seen online graphs of how acutely spiking this coronavirus onset of symptoms that will peak if patients and people don't ascribe to this social distancing, almost more like an upward peak, and that's just going to overload the medical system to where there just won't be enough providers, enough places for these folks to be hospitalized, for the ones that truly need the help. If we can maintain social distancing, self-quarantine, hand washing with soap and water, learning that keeping surfaces as clean as possible helps. Hand washing frequently is probably key. Interesting about surfaces, it seems like the virus will be on surfaces like metal and fabrics for far longer, and so those surfaces need to be cleansed. A patient asked me the other day, does laundry detergent take care of it? And the answer is yes. So simple soap and water, rinsing and doing laundry maybe a little bit more often, definitely the way to go. With your personal devices, cell phones, tablets, laptops, using rubbing alcohol, isopropyl alcohol is sufficient, and probably getting in the habit of doing that on a regular daily basis, if not more, to keep the contact time down. And a lot of health authorities are finding that wearing masks has not been recommended and not helpful. It's just not, unless somebody is known to be infected. Those folks are wearing masks, and hopefully they're at home, or hopefully not in hospital, but if they're in hospital, they're going to be quarantined. There have been a couple of colleagues of mine who've been sharing some resources to help with your immune function during this time. Those may be supplements such as vitamin D3, somewhere between 2,000 and 5,000 units a day. Additional vitamin C, 2,000 to 3,000 milligrams a day if you don't have problems with taking vitamin C. Selenium, 100 micrograms a day. Taking extra magnesium, 400 milligrams a day in whatever form you can find. And those, I think, in combination with a healthy lifestyle, getting enough rest. We say this all the time in clinic, but as much as you can to keep your activity level up, maintaining good sleep cycles, exercise, and a good nutritional base, solid, clean diet. Maybe all of these things would help your immune system in ways that we could help reduce the spread of this very concerning, very pandemic now, concerned pandemic virus, until we get a better handle on it. So it's kind of all our part to do what we can to keep the spread from happening. And if in doubt and you're sick, contact your healthcare provider, but do stay home. Don't chance it. There have been too many instances around the country where people have done that, and it has contributed to the spread. So hope all of you stay healthy and well and protect yourself. And we will be in touch, and I'll provide more updates as we know, as this story continues to develop. All right. Hope you all have a wonderful weekend. We'll be in touch. Take care. Bye-bye.